Hi guys, I hope you're doing amazing. I am doing pretty good. I'm almost 4 months post-transplant and I cannot complain. But did you know that one of the main reasons why people refuse a kidney transplant is post-transplant medications or immunosuppressive therapy? These medications have short and long-term effects, so I guess that can be pretty understandable. In this video, I'm going to share with you everything related to post-transplant medications based on my experience and just in general things that I believe are useful to know before and after transplant. I'm going to divide my medications into 3 groups. The first group is the immunosuppressive therapy, and the main job of these medications is to prevent the body from rejecting the new organ. The most common combination of immunosuppressive therapy is composed of tacrolimus, mycophenolate, and prednisone. So tacrolimus, one of my first doses was 9 milligrams twice daily. This medication is divided into single doses, so I was taking a total of 18 pills a day, and that's just for this first medication. The doses change very often based on lab results, so having the medication divided into single doses makes it easier to add or subtract pills based on the prescription changes. Most of the time my levels of tacrolimus were just fine, but they do a test that measures the levels of this medication in the blood 1 hour after taking the medication, and my levels were pretty high every time I did the test, so my doctor decided to change me to Immunosuppressive. Immunosuppressive is a slow release form of tacrolimus. The good thing about this one is that it is divided into 4 milligrams. So I have to take 8 milligrams daily. That means only 2 pills, and this one actually I only take it once a day, so that's much better. This medication is working just fine. The only side effect that I can relate to this medication and that actually just started to noticing is hair loss. My hair is falling out. I'm starting with a lot of hair, so I'm not super concerned, but I do not want to lose my hair. So I don't know, we'll see. The next one is mycophenolate. I started with 1,000 milligrams. It was only 4 pills. It's 250 each. Right after a month, I was switched to 750, so only 3 pills. This medication from day one has caused me stomach issues and bloating. To help with that, my doctor switched me to Myforic. I did notice that my stomach issues got much better, but the bloating actually got worse. The next thing to do was to reduce the dose. I went to a 360 milligram dose and nothing has changed. So I know my doctor is looking into switching me to Imuran. And the next one in this group is prednisone. I started with 30 milligrams daily, and after 2 weeks my doctor started to reduce this medication by 5 milligrams weekly. By week 7, I was only taking 5 milligrams, and that is the dose that I will be for the rest of my kidney life. When I was on the higher doses of this medication, I experienced shakiness, nervousness, fluid retention, high blood sugar levels, weight gain, and an increase in appetite. Since this medication started to decrease, my side effects actually got much better. They haven't disappeared, but they got much better. The only thing that hasn't gone away is my increased appetite. I am hungry all the time. Right now I'm obsessed with chocolate and Greek yogurt. I didn't even like Greek yogurt before. It's like I'm a whole new person. But if you're taking prednisone, what are you obsessed with? Let me know in the comments. I would really like to know, because it can be just me. I took prednisone a few years ago and I let my food obsessions run wild, and this was the result. If you're gonna be taking prednisone and do not want to gain weight, you gotta be very careful with your diet. I'm telling you, it's the diet. But anyway, so the second group is composed of Valsite and Bactrim double strength. Valsite helps prevent viral infections that can cause severe problems in people with low immune systems like us or like me. I take 1 pill a day, and I'm supposed to take this medication for 6 months and then it will go away. The next one is Bactrim. This medication is to prevent bacterial and fungal infections. I took one pill 3 times per week, and this was discontinued right at 3 months. And the last group is most likely very different from person to person depending on their needs. For me, right after transplant, my phosphorus was very low. I take a total of 4 pills a day. The next one I'm taking is atorvastatin or Lipitor. Immunosuppressive medications can raise cholesterol levels, which can lead to cardiovascular disease. I actually read that this is very common and it affects 60 to 70% of transplant patients, so something to be very aware of. I take 10 milligrams daily, and actually took this medication since I was on dialysis, and I never noticed any side effects. As you can see, this is only 7 different medications, but because of the way the doses are divided, it can turn into a lot of pills, just like when I was taking tacrolimus instead of Immunosuppressive. Before transplant, I always heard that there was tons of medications to take. I always thought I was gonna be overwhelmed with so many different medications. Nobody really ever explained to me that they divided the pills into such a small doses, and that is what makes it to be tons of pills. If there's something that you're dreading about your transplant, I think you'll be just fine. It's actually not that many medications. I mean, even if I didn't switch the tacrolimus for the Immunosuppressive, eventually as the time passes, there is lower doses required, if that makes sense. I also left the hospital with a pill box. Obviously it has all the days of the week, but it also has the times a day that I'm supposed to be taking my medications. Filling these bags is quite simple. I get this printout every time I have a medication change or anything needs to be adjusted. This printout specifies the medication, the dose, how many pills I need to be taking, the time of day, and also has some notes that tells you exactly what the medication is for and how you need to take it and things like that. So I find this very easy to follow. I never really have any problems, even when I just got back from the hospital and I was in a lot of pain and on very strong painkillers. So it went just fine. Another thing that I would like to share with you guys, and that I didn't know going into transplant, was that your blood sugar levels go high from day one. This is caused by prednisone. I never had high blood sugar levels before. I had to check my sugar 3 times a day, every day. I did that for the first 2 months. Thankfully, as prednisone started to decrease, my blood sugar levels went down. I know I do have to be careful because as a transplant patient, we are likely to develop diabetes just because of the medications. I'm watching my diet and I am exercising, not heavy exercising. I'm just doing walking, a little bit of running. That's going pretty good. Last time I went for my doctor's appointment, my labs were looking pretty good, and my doctor actually said that I have a happy kidney. That's all I have for today. If you find this video useful, consider subscribing, and I will love it if you can give me a thumbs up. It really helps this message to reach more people. As always guys, stay strong, stay healthy. I'll see you guys in my next video.